Hello friends, I am Dr. Harsh Kumar Agarwal. I am a practicing general surgeon and I live in Chandigarh. Friends, let me first of all thank you for this interaction. This is my first live session with you, but I promise you this won't be the last. Friends, I am here to specifically discuss a very interesting surgical topic called piles, also called as bawasir, also called as hemorrhoids. Now, why piles? I have selected this topic because this happens to be one of the most common problems faced by the general population. If we talk of numbers, it is present in as many as 1 in every 20 people of the population. If we take our country alone, more than 1 crore people in India suffer from piles every year. Astonishing number. Very astonishing number. And there are so many people who suffer from piles, and surgeons are not readily willing to take up the surgery for piles. I remember my teacher telling me once, and his words were, "Harsh, don't ever operate on a patient of piles till the patient literally begs you." Now, why was this? Now, this was because the primitive methods of pile surgeries were very painful. Well, I am not here to discuss the methods of surgery right now. I am more interested in telling you about what piles actually is. There happened to be a lot of confusion about what piles is. Now, any patient who has pain and passes blood in stools comes to me with a diagnosis, a self-made diagnosis of piles. Now, my dear friends, let me tell you, there are 18 different diseases which can happen if a patient has pain or bleeding while passing stools, and it is very important for us to actually examine the patient and find out. Now, briefly stating what piles are. Now, let me tell you, piles is a normal part of the human anatomy, which means that all of us have piles. Piles is not a disease. Piles become a disease only when it enlarges in size. Now, piles anatomically are situated approximately 4 to 6 centimeters above the anal verge. Anal verge means the maldwar, the place from where we pass stools. Piles cannot be seen or felt by an individual. So, it is useless to make a self-diagnosis of piles just because there is bleeding. The piles where they are situated, there are no nerve endings. So, the piles would not have pain. So, the very fact that pain occurring in a patient of piles, unless the piles are complicated, is a big mistake. And I totally fail to understand how certain traditional systems of medicines can treat a patient of piles without examining. It is impossible. Unless you had a look at what piles are, you cannot treat piles. And I said, let me warn you, even cancer is one of those 18 diseases that I am talking about. Well, my intention is not to scare you, because having cancers in the rectum is a very, very rare disease. It is piles which is the commonest, but then it has to be properly diagnosed and only then can you treat it. Now, piles are nothing but cushions of blood. Cushions of blood, what I mean to say is, at about 6 centimeters above the anal verge, मलद्वार के 6 सेंटीमीटर ऊपर, पेरीफ्री, पूरी सर्कमफ्रेंस ऑफ द एनल कैनाल के ऊपर ये ब्लड के कुशन्स हैं. अब इनका काम क्या है? दे आर देयर टू गिव अस कॉन्टिनेंस. नाउ समबडी सिटिंग इन माय ऑफिस हैज टू पास स्टूल्स और हैज टू पास गैस. ही कैन कंट्रोल इट only because of presence of piles. Now, piles, they are an anatomical structure which are actually beneficial to all of us. Now, what happens when they start growing? When they start growing, they not only grow towards the inside, they grow downwards also. And they grow so much that there is a time when they tend to come outside the anal canal. Now, what happens when there is a tissue inside the anal canal? Then what will happen is the pathway for the stools to pass out will keep on decreasing. If I may explain in Hindi language, अगर पाइल्स मलद्वार के रास्ते में फंसे हुए हैं तो स्टूल पास करते हुए जगह कम रह जाएगी। एंड बिकॉज ऑफ दिस जब हार्ड स्टूल पास होगा तो पाइल्स जो ब्लड के कुशंस हैं वो फट जाएंगे और ब्लीडिंग आएगी। और सबसे कॉमन जो सिम्टम पाइल्स का है दैट इज पेनलेस ब्लीडिंग। Painless bleeding is the first symptom. So there are lot of other reasons which can be easily treated with medicines where there is pain. So if a patient comes to me कि sir pain होता है बहुत ज़्यादा, I keep my diagnosis reserved. Piles is a painless condition. That is number one. Now I stand corrected because if you have complicated your piles, if the piles has increased from grade 1 to grade 4, then yes, pain can occur. Don't get confused. I'll explain what the grading of piles is. Now, grade 1 piles is when the piles are there at its position about 6 centimeters above the anal canal and are slightly enlarged or engorged. Now, grade 2 is जब piles मल द्वार तक पहुंच जाता है. That means they have enlarged so much that they are there from 6 centimeters down to the anal verge, but they will not come out. That is grade 2. Now in grade 3 the pile mass will come out and has to be reposited inside. It has to be pushed back inside. That is grade 3. And grade 4 is when they come out while passing stools and they cannot be reposited inside. That is because the piles have the blood inside them which has clotted. The blood inside the pile mass has clotted. Now the grade 4 piles will definitely become very painful. Now once a gentleman has piles, now let me tell you gentlemen, why I mentioned gentlemen is because the gents are more prone to the piles disease. Of course it is commonly found in women also, but yes, men suffer more from piles. Now it is a disease which usually starts at about age of 20, and I attribute 4 different reasons which I called FICS. F-I-C-S. F is for fast food, and we all know why fast food is responsible. I is for insomnia. Now in today's world most of us suffer from insomnia. Insomnia मतलब नींद नहीं आना. For one A to Z reasons, all of us are suffering from if some level of insomnia now and then. That जो grandfather बताते थे कि बेटे रात को 9 बजे सो जाओ, सुबह 5 बजे उठ जाओ. I don't know how many of us are actually following that. So the I is for insomnia or lack of sleep. C is for constipation. Now constipation is a very interesting subject. इंडिया में जब जंगल पानी का टाइम होता था, जंगल पानी का मतलब होता था when there were no toilets at homes, people used to go out to the fields to pass stools, and men and women alike. And of course because of social inhibition, this all used to happen before the sun rose. अंधेरे में जाके होता था. Now that tradition has been carrying on. Even now children are forced to pass stools before they go to school. Now constipation as per medical definition is you just have to pass stools twice a week and then you are not constipated. और हम इंडिया में क्या कर रहे हैं, बैठे बच्चों को भेजो बाथरूम में, बैठे बैठे जोर लगाते रहें और पाइल्स तो होगी. So constipation is one big reason for piles. What is S? S is stress. I keep telling my patient, don't take stress. No, it is easier said than done. Stress is a very natural thing which comes to all of us very spontaneously, and it is a part and parcel of a day-to-day competitive life. All of us are running a race and stress is a part of it. So FICS, fast food, insomnia, constipation and stress. These are 4 reasons which have been attributed to the formation of piles. Yes, of course, genetic predisposition is another factor. Lifestyle plays a very major role in the formation of piles. Now, what should you do if you have piles? You can never make a diagnosis of piles yourself. A surgeon specifically has to push up a hollow tube up your anus, which is called a proctoscope, and has to flash a light into the proctoscope to see your piles. The only way to avoid this is to see if the piles are prolapsed or not. That means if you have prolapsed piles, of course the diagnosis is written on it. Now, once you have piles, if you have grade 1 piles, the natural history of the disease is this will not regress. Grade 1 would become grade 2, grade 2 would become grade 3, grade 3 would become grade 4, and grade 4 would become complicated. So, it is best to get your piles treated as early as possible. Now, what should you do? If you have any symptoms of bleeding per rectum, bleeding while passing stools, painless bleeding in particular, or if you have itching around the anus, if you have sudden onset of constipation which you've never had before, or if you feel that you are not able to evacuate your stools completely, that means after passing stools you are not satisfied कि मेरा पेट साफ हो गया, that is the time when you must consult your proctologist. Go to a qualified anorectal surgeon, get yourself examined. It takes about 15 seconds to do a proctoscopy. A video proctoscopy is even better than a traditional proctoscopy, but then video proctoscopy is not available everywhere. A simple proctoscopy and a simple digital rectal examination is all that is required to make a diagnosis of piles. Now, a simple rectal examination is never painful. Yes, my friends, embarrassing, very embarrassing, alright, agreed. But then you could prevent a disease from progressing to very painful condition. Do not ignore bleeding from your orifices. It is very important. And you know, at piles which are low grade piles would give you bleeding which would very slowly trickle down, and it is usually ignored. अच्छा यार 3 महीने पहले blood आया था, उसके बाद तो आया नहीं. Most of the times you may have missed it. So if you had bleeding while passing stools, it pays to go to a doctor and to get yourself examined. Now, if you have piles, now in the present scenario, there are a lot of methods, lots of methods which are painless. They are called minimal invasive treatments of piles. There are a lot of minimal invasive like the stapler, the hemorrhoidal artery ligations, Doppler based treatments. There is a laser treatment for piles. A lot of other wherein you can get yourself operated on a day care basis and get back to work in the next 48 hours. I am saying this because after I developed a keen interest in piles, I have more than 12,000 surgeries to my credit. I have been training myself in doing all these procedures, and in my experience of the last 17 years in pile surgeries, I have found that the hemorrhoidal artery ligation operation is one of the best methods to operate on piles. This is the universal method. It is a quick method, just about 15-20 minutes. It can be done on OPD basis. This is the method which is being followed in United States, where it is not called hemorrhoidal artery ligation. There it is called transhemorrhoidal dearterialization, THD. In North India, I am one of those few who are doing the hemorrhoidal artery ligation. It is a procedure which can be done in all the piles ranging from grade 2 to grade 4. Even recurrent piles can be treated by this procedure. Any patient who has a liver disease, any patient who has ulcerative colitis, this treatment is the treatment of choice because no cutting is involved in this procedure. There is no pain in this procedure. There is a special equipment required. It is a very pocket friendly procedure, and I assure you that this procedure is so good that any piles patient would get benefited without fearing for pain or for expenses. I shall end my talk here today. I promise to come back again to give you details of all other treatment modalities for piles. God bless you. Thanks a lot.
Sir, there is one question from a viewer.
Sure.
She's asking post-delivery piles ठीक हो सकती हैं क्या?
Yeah. Now, as I said, there are different etiologies for piles. Now, what happens is in a lady who's carrying the pressure of uterus, it bears on the rectum. Now, anatomically, uterus के नीचे rectum होता है. तो अगर uterus का size बड़ा होगा बच्चे की वजह से, तो piles जो रेक्टम के ऊपर प्रेशर होगा, बिकॉज ऑफ दिस देयर विल बी